210 million. What is that number? That is the number of people who suffers from lower back pain at some point in their life, up to 70%. And that's only in the US. 300 million times 70%, that's 210 million people will suffer from some form of lower back pain some part of their life. And a good part of that is sciatica. Now, here's the thing that most people don't understand. 90% of sciatica is due to a nerve root compression, whether it's from a disc herniation, a disc bulge, a pinched nerve. One way or another, the nerve gets pinched. Well, how does that work, Dr. Tam? I mean, people ask me all the time, how is it that I have sciatica? Well, sciatica is one of those things where most people don't understand. You think it's this pain where you have going from your lower back, down your buttocks, down the leg, off to the side, maybe hitting your big toe. But, well, how does it even get there? I'll tell you what the traditional treatments are of sciatica. You tell your doctor you have sciatica, right? What's the next step? Here's a pain pill. Maybe here is some physical therapy. Now, if that doesn't work, well, maybe try a cortisone shot. Yeah, maybe an epidural to try to numb the pain out. Yes, maybe that will numb out the pain. But does it go after the root cause of the problem? Absolutely not. See, I like to show you what actually happens inside the spine when you look at it. These are joints, okay? You have a normal one, stage 1, stage 2, stage 3, degeneration. Well, when you look at a bone, a good one in the back, you have something called a spinal cord. You see, that's that piece right there. Now, you might not be able to see it. Am I on the screen here? Right there, behind the disc, it's the spinal cord. And at every single level, you have spinal nerves coming from your neck all the way down your lower back. For example, the spinal nerves in your neck controls your shoulders and your arms. The spinal nerve in your lower back controls your legs, okay, your toes, and all the muscles and ligaments between your hips and your legs. Now, here's the problem. How it happens is the cause of the problem. The cause of the problem is rarely genetics. How it usually works and how people injure their spine and how sciatica happens is it starts off with an injury. Now, for example, you have an injury. Let's just say maybe you were young, okay? A lot of us are young but not very smart. We call it young and dumb, okay? We do dumb things. We think that we're invincible when we're in your teens, when we're in our 20s, maybe even our 30s. But at our 30s, maybe mid to late 30s, I think that's where I'm at right now, it starts to catch up with you. So here's what happens. Between your disc, and bone, that's the three structures. 2 bones above and below and the disc in the middle is what holds up this nerve. And when you talk about sciatica and how 90% of it is due to a compression of the nerve root, it's usually going to be L3, L4, L5, okay? 3, 4, 5 goes down the leg. And here's how it works. Whenever you have an injury, okay, your body and your spine, usually if my fists were the bones, it's gonna go back and forth, okay? 2 bones and a disc in the middle, and it's gonna go back and forth really, really well, all right? But what happens is, if there was a disc in the middle, let's just say this plastic cover is the disc, and the bone on top and bottom is gonna sit right there. Here is the bone top and bottom. And normally, we're gonna go back and forth, no problem whatsoever. But here's what happens. Anytime when you have an injury, it can lock up that joint, boom. And now, instead of moving smoothly, it starts to grind back and forth. And you know what happens when it starts grinding back and forth is your disc now is no longer going to wear and tear the right way. It's gonna have abnormal wear and tear. Well, when it wear and tears the wrong way, can it sometimes catch a nerve and now pinch a nerve? Absolutely. This is where you're gonna be twisting and bending and boom, something catches. See, when something catches, when you're doing something lightly, like maybe just turning around, grabbing something from the back seat, or you're just lifting a tray and you feel a pain all of a sudden right there, it's usually not the first time you've had the problem. This is gonna be most of the time an ongoing thing, Maybe you're thinking, wow, my back catches every 2 to 4 years, and it's not that bad. I go in and get some medication or get an epidural cortisone shot, and it gets better. Well, the problem is, over the years, the problem is that your joints will start wearing from here, where the disc starts eating away in phase 1 degeneration, and this typically happens maybe 5, 10, 15 years. But you add another 10 to 15, now it starts not only eating away at the disc, it starts to eat away at the joint. And that's where that disc will start to bulge out, or the disc will herniate. And as it herniates, just like this one, it can pinch a nerve. My goal as a doctor, and a holistic doctor and a chiropractor, is to prevent this problem from happening. But what I see in people 90% of the time, you're not coming to me when you're here or even here. 90% of the people are coming to me here or here. And there's gonna be a point where the disc is so far gone where you're literally bone on bone, and now your nerve has no room to start going down anywhere. You start to lose muscles in your legs, your muscle starts to atrophy, it's not getting any nerve flow. The same nerves, 3, 4, and 5, also controls a few other things that maybe you haven't thought about. So legs is one of them, but did you know it also controls your bladder, causing frequent urinary tract problems, frequent bladder flow, loss of bladder control, okay? Number 2, it controls your colon. Diarrhea, constipation, problems with holding your bowel movements, going too soon, going too quickly, not being able to go on a daily basis. That's a second problem, or third. And then the most important thing for a lot of people, now a lot of people think this is more important than the other ones. Well, you kind of have to see what your priorities are. It's your sexual and reproductive organs, okay? Because that is also the nerve, the same nerve that controls your legs when it's being pinched at your nerve root, all right? It's also controlling your reproductive and sexual organs. And that's the problem. These are the 4 main areas between your legs, your bowels, your bladder, sexual reproductive organs. It controls all of it. And when that nerve pinches, you're not going to be able to do any one of those 4 things well. Or maybe you'll do well with one, but the other 3 will start to suffer. Eventually, all 4 will suffer because the nerve root controls all 4 of them. If you'd like to find out more on how you can keep those 4 things working in your body, when you come into our office, 3 things happen. Number 1, we're going to take you through a complete consultation where we sit down and try to find the root cause of the problem. We'll take you through exams and x-rays, because without x-rays, you can't tell whether you're here, 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 or here. How do I know whether or not I'm going to be able to help you without taking one of these pictures? If that's what you want to do, give us a call and really find out how we can help. That's what I'm here to do. I hope to see you soon.